All right, how are we doing, San Diego? It's Dr. Jason Shumard with Integrative Wellness Center. So I want to bring up a quick little video with you guys today in regards to the thyroid condition. We see a lot of patients in our office dealing with thyroid problems, and I've gone over and done a three-part series for thyroid. So if you haven't already seen those, make sure you look back on those and go over those again in detail. So today I want to focus on a little more about some underlying causes. I speak to lots of patients in my practice that are dealing with thyroid conditions, and their doctor's telling them that their thyroid is functioning normally, that everything is working perfectly fine, even though they don't feel good. They're still having symptoms. They still don't feel right. They're having fatigue, they're having brain fog, hair loss, and telling their doctor, and they're just not getting the doctor to do anything about that. They're not really listening to their underlying mechanisms. So today I want to discuss more in detail some of the problems that could be going on. On one of my video series, I think it was part 1, I spoke about the blood work that's being done by your doctor. And in most cases, they're going to run 1 or 2 different markers, TSH, T4, free T4, something like that. But I want to go in detail a little more about those markers, the importance of the markers, because I just did a verbal analysis on there, but I want to go over and show you on the whiteboard behind me and write everything down. So if you're watching this video, if you watched part 1 and you weren't able to get everything properly, you want to see a little more in depth, what's really going on and why it's so important to run the right markers. Because think about this. If your doctor is running your blood work on you and saying, hey, your TSH is normal, your thyroid is normal, everything looks good, but you still don't feel good. You still don't feel right. You're letting them know, hey, I still have these symptoms. I'm still having fatigue. I don't feel good. I'm gaining weight. I can't lose weight. I'm sleeping terribly. I have extreme hair loss. Like, I just don't feel right. Something is off. And they're not listening to you. Well, if your thyroid numbers look normal, meaning if your TSH looks normal, but you're still having symptoms, doesn't it make sense to start to open up the panel to really look at what else could be going on there? So let's talk about that. I'm going to write these down for you and then go a little bit more in depth and what the thyroid does and potentially other things that could be going on. Because when you really look at the full panel, you can really see things that are beyond the traditional just looking at TSH. Okay, so let's talk about those. So obviously the first one we just spoke about is TSH, right? TSH is very important to analyze. It's what's being done right now by your doctors to see if you need more medication or if the current medication you're taking is appropriate. So meaning if your TSH goes up, right, it's inversely related. So if your TSH goes up, that means you have a low thyroid. Your thyroid is not functioning optimal. It's also referred to as hypothyroidism. If your TSH is low, right, that means you have a suppressed TSH. That means you're dealing with a hyperthyroid. But if you're taking medication like levothyroxine, Synthroid, or maybe a bioidentical, then essentially your doctor is going to manage your thyroid based upon how much hormone to give you. So if your TSH goes up, they're going to increase your medication. If your TSH goes down, they're going to decrease your medication. And that's basically the yo-yo or roller coaster ride you're going to be taking as you're being managed with this condition. So TSH is obviously one of them that's really important, but most of you who are dealing with thyroid conditions is already getting this test done. So T4 is another one. This is a hormone produced by your thyroid, very important marker. This one is not often measured. They're usually going to measure what's called free T4. That's a more common one they're going to measure with your doctor. So you may be getting TSH and free T4 measured, but T4 is also something that should be analyzed. T3 is another one that's being measured as well. They may or may not be doing this one, more commonly not, in free T3. So the F stands for free, so free T3 and total T3. Typically when you get these other numbers right here, it's going to be probably an endocrinologist who's managing your case compared to your primary care physician. But these ones should be measured. We also want to look at some other ones. I'm going to abbreviate this one. It's called FTI, or free thyroxine index. That's what that looks for there. We also want to look at T3 uptake. This is a way we can analyze to see how well that your hormones are getting from your thyroid to your body. And so that's an important marker because it can tell us if there's certain things that are going on in the body that could be blocking your ability to getting thyroid hormone. Now, we also want to measure reverse T3. That's the R. The R stands for reverse T3, another important marker. And then there's two other ones we want to look at. One is called TPO, thyroid peroxidase. And then I'm going to abbreviate this one, thyroglobulin antibody. It's AB stands for antibody. So these are two antibodies. These are very important. And if you want to know why those are important, you can always watch my video sequence number 3 that we just did recently. Talks more about why the antibodies are really important to look at there. But this is what we need to look at. We need to see all these markers. So if you're in a situation right now and your thyroid is quote unquote normal, meaning your doctor is saying your thyroid is normal, then maybe it's important that you let your doctor know that you want to have additional tests ran to see if there's something else going on. Now, not only is it important to run these tests, but you have to make sure you're giving this information to someone who can analyze it, read it appropriately, and give you a specific outcome or what needs to be done if something's off. So why are all these numbers important? They're important because depending on which level is working properly and which one's not, we can see where the problem is stemming from. So your TSH could be normal, by the way. It could be fine, but one of these other numbers are off, which is going to tell us underlying mechanisms or problems you're experiencing that is contributing to or causing your symptoms you're